In regards to thoughts and feelings, it's time to start thinking about this new reality and figure out what your priorities are now. That said, it's rare that a treatment decision actually have to be made right away. More often, you'll have time to think it over, take it in, and look inside and around yourself. Think about where you are, where you'd like to go, and what you'll need to get there. In order to do this, I'd like to provide some questions to ask yourself, with the goal of looking past the disease and to understand yourself, your history, and the way you tick. These questions are best answered in dialogue and in multiple junctions over time. Use them as a conversation starters with your family or therapist. What have I been doing with myself? When we're stressed, we tend to revert to base, familiar territory. Pay attention to how you're coping now and consider how you've coped with difficult things in the past. You're looking for clues on how you might want to move forward this time. Keep an eye out for both the constructive and destructive. Have I been drinking a lot? Getting happily engrossed in work? Knowing this will help your team determine the parts of your routine that should be nurtured and protected and what should be dialed down. What do I find myself thinking about most? Often the worries that surface tip you off to what needs attention. Maybe you can't stop thinking about what will happen to your spouse's health after you've gone, or how you're going to get the kids to school on treatment days. Or maybe you keep thinking about visiting someone or some place, so you might want to make that trip a priority. Whatever it is, your mind is trying to tell you something. Start somewhere. The idea here is to ease your burden whenever possible to free up time and space. When and where during my day do I feel the best? And when and where do I feel the worst? What are your daily patterns? What people, places, activities, and things might you avoid, and which might you seek? How has my mood been? If you're angry, where is that anger directed? If you're sad, how are you handling it? If you're strangely giddy, you either have everything in perspective or maybe in denial. Your mood offers you and your loved one cues about what needs attention and how to respond. Asking yourself this question is an invite to let it out. What am I most proud of? What do I like about myself? What are your strengths or interests? Looking for aspirations. What do I want to become? Is there a trait or habit I'd like to change? There's always room for growth. Have I ever lost someone close to me? If the answer is yes, thinking about how they made their way to death may help you consider your own choices. Do you have old grief and fears from that experience? The past will color your choices, so take a moment to sift through whatever thoughts and feelings bubble up. If the answer is no, then you might expect to have more questions for your doctor, or to not know what to ask in the first place. It's a good idea to make that confusion clear. Lastly, the one question that should be the central guiding force in your care plan is what's most important to you now? It might seem like an easy one at first, but it could be hard to answer, not unlike who are you? It's possible that what's most important to you now has nothing to do with treatment. When thinking of all these questions and feelings, remember to have courage, be vulnerable, and connect with others.